Over the last 5 years, we have been supporting healthcare electrification in the region across 4 main countries, that is Kenya, Uganda, Ethiopia, and Tanzania, especially in terms of providing the right kind of data and analysis that can be able to inform healthcare planning or electrification of healthcare facilities across these countries. And so we have been collaborating very closely with the national governments as well as subnational governments in terms of understanding where do we have poverty in terms of energy needs for healthcare electrification, but at the same time, again, understanding where we have facilities that are not electrified, and hence then the need for us to be able to prioritize in close collaboration again with the national and subnational governments. But I think overall, and again, considering that we have been working very closely with WRI-India, and also listening from today's conversation, is that there are so many similarities in terms of the challenges that we face in Africa in as far as healthcare electrification is concerned, and also our counterparts or the other region here in India, listening about the population of facilities that are not electrified, despite all this notion that India, for example, has achieved near 100% electrification targets, but then you have facilities that still don't have electrification, number one, but also number two, in terms of reliability for electricity in these facilities. And what exactly does that mean in terms of providing quality healthcare services? It's the same challenges that we face also in Africa. And so for me, I see lots and lots of similarity between what India is facing and what Africa is facing, and how we can be able to also learn and cross-pollinate some of these lessons in terms of achievements, and also no need for us to replicate some of the initiatives that, for example, India has done, and vice versa. But what can we be able to learn from each other and be in a position to do much better?